What? This is Lip Bone Redding. You're listening to WMNF, Tampa.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Glad tidings to you, my keen-eyed buddies out there. This is WMNF Tampa, your resistance radio station from Tampa Bay to the Gulf of Mexico, and the most awesome little community-supported FM station that anyone could ever want to listen to as they glide down Lincoln Highway on cruise control. And you too, my friend, can stream us anywhere in the world by going to WMNF.org. Today is Ask Me Anything Monday, your 1 hour window to express your medical questions and concerns to the doctor who cares. Just give us a call at 813-239-9663. Sage is sitting in the control room like the vigilant aide-de-camp she truly is, just waiting to take your call. So once again, that number to dial is 813-239-9663. You can send an email to dj@wmnf.org or text us at 813-433-0885. Good morning to you, Dr. Harvey. You've got another Ask Me Anything Monday ready for us, so let me small myself on up and let you get started. What have you got for us today, Dr. Fred?
Well, good morning and happy June. We've made it through another month.
Yes, isn't that incredible? And a lovely month this is going to be.
I agree. I'm looking forward to summer arriving very shortly, and all the good that comes with the extra heat, because my mango trees are burgeoning, and I can't wait to start harvesting. So, as usual, Amy Goodman presents a little bit of good information. Usually a lot, actually, but there was some health-related stuff here today, and I really like actually, that was after Amy Goodman, the news, told us about this new pancreatic cancer intervention that's showing great promise. It's really amazing what our modern technology brings to us. American pharmaceutical and European pharmaceutical companies do some amazing work at helping people recover from illness, and really, I'm just impressed with some of this stuff. Earlier, I was reading about breast cancer, and they found that there's a genetic test that can be done in breast cancer patients. And this genetic test actually shows whether or not a person afflicted with cancer is going to be needing chemotherapy. I think when somebody gets a cancer diagnosis, one of the worst things they think about is the adverse consequences of the treatments. And to be spared the need for some of the intensive breast cancer chemotherapy that we know is really problematic for many people would be great. And this is suggesting, I think that it was saying that maybe 50% of women have this genetic setup. It's a genetic test. So it would tell us that they are going to have the same benefit by doing hormonal blockade that they would have had with chemotherapy. So it's really impressive that we're finding these connections that are helping people get better treatment and avoid treatment that isn't necessary, thus getting more appropriate treatment for their problem. And that brings me back around to another set of information, and that is that we don't have to simply rely on external sources for our health. In fact, we shouldn't. Because if we rely on internal sources, we're going to be healthier, because our internal sources are what manifests the level of health and illness that we experience. And so there's a recent article that was talking about better living after cancer. And I've talked about this before, but they've done some more extensive research on it. And they've looked at many studies. They did a retrospective meta-analysis, which means they took a lot of clinical studies that involved thousands and thousands of patients and pooled the data to see what the overall picture is for these people. And what they were looking at is two interventions that you can do for yourself that will affect your mortality from all causes, but also will affect your chances of dying from specific cancers. And so the first thing, it's very easy. We just have to make a choice to do it, and we have to, do it within reason for our own bodies, and that is exercise. People who have been sedentary and add exercise to their daily regimen can experience, for people who've been diagnosed with breast cancer, a 36% overall decrease in mortality, all causes, just by getting your exercise done on a daily basis. And in addition, there's a 31% reduction in death from breast cancer. For prostate cancer in men, you get a 37% drop in overall mortality and a 27% lower risk of dying from prostate cancer. So you get it's around a third decreased for both ways. And that's saying a lot, because if you've already been diagnosed with breast cancer or prostate cancer and you can reduce your risk of dying from that by 30%, just by exercising regularly, that is impressive to me. And the second thing that they looked at was diet. And women with breast cancer who did a lower fat diet had a 24% lower recurrence rate. And if you look at the Mediterranean diet, which is a high fiber, high vegetable and fruit, lowered meat, highly varied, diverse diet, you'll get a decrease in the risk of death by 23% from breast cancer, that is. And more impressive is you get a 50% reduction in your risk of dying from colorectal cancer if you change your diet. Kind of makes sense to me. If you're going to stop putting the toxins into the place where the cancer is, then it's likely you're going to get a really good reduction. And that brings me to another nuance in the issues of exercise. I think everybody who's listening has probably heard about 10,000 steps. And it's interesting. I read a very interesting historical article about this 10,000 steps, and apparently this was a Japanese creation. And in Japan, the character for 10,000 resembles somebody walking. It's kind of arbitrary, but the work they did with it shows that 10,000 steps actually does have a significant impact. But more recent research suggests that 10,000 steps is what most people get in doing modest exercise level for 30 minutes. And so it comes back to the 30-minute rule, which has been something that has shown up in literature for decades. So you don't necessarily need to count your steps. And it's pretty hard if you're not wearing a Fitbit or something like that. So I'd recommend just timing your walk and get 30 minutes a day. And you're going to get, that's a moderate exertion on your walk. Don't just do a slow stroll, but go with some purpose and you'll have the benefit. And I think that's really a simple way to look at it. Walking for 30 minutes a day has the potential to reduce your risk of overall mortality by 36, 37%, and reduce your risk of death by cancer that you've already had and treated by 30%. That's impressive work. So if you can just get moving, you will actually improve overall health and risk of death. And I'd like to talk to you more about this. This is the Healthy Steps Show. I'm Dr. Fred Harvey.
And there, Doctor, I do have a caller, Victoria from Gulfport, waiting for us, but I'm going to keep her in the queue for just a few seconds there, Gloria. Hang on. I want to remind folks that you are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, and I'm inviting you to participate by calling 813-239-9663. Sage is taking the calls today, so the number to dial is 813-239-9663. And you can continue to send your emails to dj@wmnf.org. Good morning, Victoria.
Hi, good morning. Beautiful day.
Beautiful day.
I wanted to talk to you, doctor, about I'm pretty healthy, exercise all the time, breast cancer survivor, eat well, do all the good things. But on April 27th, the day after my birthday, after my walk, I came home and my heart started racing and stayed at between 130 and 176 for about an hour and a half. So I went to urgent care, and they did an EKG and blood test. And, of course, everything by that time was normal. So I went to my regular doctor 2 days later. She did the same thing as well as a thyroid blood test. Everything was normal. So she said, come back and see me in 30 days. So almost exactly a month later, it happened again, but not quite as high. So she's on vacation, and I called in the information. She has me taking little EKGs on cardia and seemed to be okay as well. But she put me, which I haven't taken yet, on metoprolol.
Yes.
And yeah. And I haven't taken it yet because I'm a little nervous about it because I do have light asthma, and it looks like the side effects are the same as the symptoms that I've had in terms of maybe a little short of breath and getting up quickly and being tired or a little bit out of breath. So
What's your age?
Reluctant. 71.
Well, you had what sounds like possibly supraventricular tachycardia, and that is a not dangerous rhythm, but it's not something you want. It's the top part of the heart going really fast. But it's different, and I don't know because it didn't show up in EKG. There's another thing that can make symptoms like this, and that's atrial fibrillation.
Right.
And we don't know what you have, correct?
Yeah, correct.
So at 71, even if you're healthy, I think it's worth it because you've had 2 episodes with normal blood work, like no thyroid pressing on it or anything like that. It's probably worth it to get a cardiovascular workup. You may have a problem with ischemia or low blood flow to the heart that may have brought this on. Also, if you have a sleep disorder, this could be triggered by sleep apnea.
I do have sleep apnea, and I wear a mouthpiece at night.
But you don't use CPAP?
No.
So has anybody checked your oxygen since you've been using the dental device? Has anybody checked your desaturations at night?
No.
Okay, so you don't know if your sleep apnea is treated.
Right. Well, I did wake up about a month ago about the same time snoring, so I went back to the sleep doctor, and he extended the bottom piece so that my jaw would get out further.
So nobody checked to see if you're actually having events with this device. They just, if you tell them you snore, they adjust it for you.
Right.
All right. It sounds like you need a better evaluation because if your oxygen is still going low at night, you're risking arrhythmia.
Okay.
So somebody should probably do a little bit more workup. Since you have the sleep apnea, I would pursue that. There's an easy tool called an overnight oximetry. You don't even have to do a whole overnight sleep test. You just wear the thing on your finger overnight, and it will tell you if your oxygen goes down at all.
I did do that when I first was diagnosed. I did the sleep test before that. So you think maybe another one should be in order?
I just don't understand why sleep doctors don't repeat it after they've started the treatment. It's
Right.
confusing to me because nobody knows if you're actually improving.
Okay.
I mean, you don't snore, but that doesn't mean you don't have sleep apnea and oxygen
Right.
desaturation at night, which is the problematic issue.
Okay. All right.
So,
Well,
yeah,
I will.
talk to them.
I think I'll hold off on taking this drug until I talk to her about doing these other options.
Well, that's your primary doctor
Yeah.
or your sleep doctor?
Well, I have an appointment with the regular doctor this week sometime.
Okay.
So,
If I were you, since you have a sleep doctor, I'd call up the sleep doctor and see if you can order an overnight oximetry. The oxygen supply people and the CPAP supply people actually do those tests.
Okay. All right. Well, I will do that first and see what happens there.
Okay.
Thank you so much.
You're very welcome.
Have a good day.
You too. You too.
Thank you very much there, Victoria, and good luck to you. Best wishes. But now the studio has gone dark, and dark is great for stargazing on a summer night, but it's not very pleasing while we're waiting for the boards to light on up. So I'm inviting you to participate in the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa and address your medical questions or concerns by calling 813-239-9663. Again, let's put Sage to work and get you to dial the numbers 813-239-9663. And you can continue to send your emails to dj@wmnf.org. Back to you there, Doctor.
So I saw another article this morning that was of interest in the way it asked a loaded question. And it's so generic. It's such a hard thing to answer. But do supplements work, and are they safe? Was the title of the article. And there's so many layers there that I can dissect. It's kind of amusing. Like, do supplements work? Okay. Why? Like, what are you wanting them to work to do? Are you trying to interchange a supplement with a medication and pretend like it's the new treatment for your medical issue? Or are you trying to prevent something? Or are you trying to fix a nutritional deficiency? I mean, it's pretty obvious to me that if you have B12 deficiency and you take B12 and your B12 deficiency is ended, that worked. But beyond that, was there another goal for taking the supplement? You know, if you have Alzheimer's disease and you want to take, fists full of omega-3 fish oil pills, yeah, you'll probably get a higher omega-3 level, but you're probably not going to be treating your Alzheimer's. So the supplement would work to replace your omega-3, but not necessarily treat a disease. And then on the flip side, are they safe? Yeah, supplements are basically food concentrates, so most foods are pretty safe, but when you concentrate them in higher doses, it becomes problematic. And if you don't do things that are also healthy with it, it can create problems. There's some confounding information about omega-3 supplements in that in a group of men who've taken them who have prostate cancer, they actually get a more aggressive prostate cancer. But there's no explanation as to why. It's just a concurrence that has been statistically proven to be significant. But we don't know what the deal is. So it's apparent that men with prostate cancer should probably not take pounds of omega-3s, but rather consider eating some boneless, skinless mackerel fillets in a can, where you get it out of the food and you don't get the rest of the problem of taking synthetics that may be rancid. That could be part of the problem. Taking rancid oils could be an issue. And with that, I'd like to talk to you about some things. So I think we have some callers online.
Actually, we do. We've got two. We've got Ahmad and Johnny. Johnny's calling all the way from Brooklyn, but I want you to be calling as well. The number to participate in the Healthy Steps radio show is 813-239-9663. Again, the number to dial is 813-239-9663. Good morning, Ahmad.
Yes, hello.
Hello, Ahmad.
How you doing, Doc?
I'm doing well. How are you?
Fine, thank you. I have this question in my mind about a rash on the feet and the buttocks and genitalia area.
Yes.
And we went to the skin specialist, and he said it's a skin fungus of some sort, and it's benign.
Yes.
He gave us a medicine, I don't remember the name of it, and some pills. But the rash seems to fade away, but it's still there. It's not eczema. I'm just...
No. It's likely a fungus infection, not eczema. And sometimes the fungus infection treatment needs to go longer than the apparent disappearance of the rash. Because the fungus is still present as the inflammation goes away. The reason you see the rash is your skin gets inflamed from the fungus infection. And so you may need a longer course of therapy if it did begin to get better.
Yeah, the medicine does help. It's not as dark as when it's...
Well, how long have you been taking the medicine?
Maybe I'd say 2 weeks, about...
Oh, okay. Yeah, it may take the actual residual, the post-inflammatory skin changes, months to resolve, but the initial rash often gets treated for 2 to 4 weeks.
Okay. Also, I was thinking if it has to do with Rinvoq or not. I talked to the Rinvoq people, and they said they've seen the situation before. But then
I'm sorry, what kind of people?
Rinvoq. The medicine.
What's Rinvoq?
No, Rinvoq, a biologic.
I'm still not understanding. Can you spell it?
Yeah, Rinvoq, Rinvoq.
Oh, okay. A new medication, it sounds like.
Yeah, and I was thinking maybe it has to do with it, but then sooner or later, the rheumatologist says, no, it shouldn't. The rheumatologist says, in fact, this should help the itching, which is there because of the rash. I'm just curious if it does or not.
So you're taking Rinvoq.
Correct.
And how long have you been on that?
Oh, since last year, maybe about 8 months, 9 months. And it works great.
Okay. And you're taking it for giant cell arteritis?
I'm sorry?
You're taking it for giant cell arteritis?
Yeah, for rheumatoid arthritis.
Okay. Let's see. Rinvoq is associated with a bunch of different things. Increased risk of serious bacterial, fungal, viral, and opportunistic infections is the #1 black box warning. Yes, this medication is responsible for your problem. You will have trouble getting rid of fungus infections when you take this medication.
Interesting.
It also has a higher rate of all-cause mortality, including cardiovascular death, malignancies at increased rates, higher rate of myocardial infarction and stroke, and thrombosis, clots.
Should we switch to another biologic?
Well, I have another opinion about that whole thing, and that is you have an autoimmune disease, and you've not talked to a functional medicine doctor about the reason you've got a autoimmune disease.
Well, the rheumatoid has been around for a while.
Yeah, so rheumatologists are interesting in that they focus solely on rheumatologic diseases and give people toxic pills like Rinvoq to treat these diseases. But functional medicine doctors help people recover from the diseases so that they can eliminate the problem. It's not always successful, but in huge amounts of time, we find the triggers for your problem and it calms down, requiring then less medication intervention.
Not quite sure I understand all of it, but
Okay, what I would suggest is you look up functional medicine. There's a website called the Institute for Functional Medicine. Its website is ifm.org. You can find information about functional medicine on there, but you can also then go to the doctor finder and look for a doctor in your area who practices functional medicine. We functional doctors look at human health rather than focusing only on the illness.
So it's ism.org, functional medicine?
Correct. Yes.
Okay. I will do it. I appreciate your time and help, and keep up the good work. I appreciate you.
Thank you. Thank you. Thank you for calling, and I really appreciate your input here because I learn new things every day when people call, and I had not known about this very dangerous medication called Rinvoq.
You've been in my mind for quite some time, and I've been following you every Monday, but I can't miss it sometimes. Take care, my friend. Thanks.
You too, and if you get a chance, consider hitting the tip jar so we can start the fund drive early.
I'm sorry, say that again?
Our fund drive starts next week, and if you really enjoy this show, consider going to the tip jar and donating to keep the show and the radio station going strong. And honestly, Circle of Friends at $5 a month is a great thing to do to support this station.
Be glad to. I've been listening to the station for at least 20 years or longer.
Oh, fabulous. It deserves your support.
Thanks again, Doc. I appreciate it. Thank you.
Have a great day.
You too. Bye-bye.
Best wishes to you there, Ahmad. And yes, thank you very much for your support and listening to WMNF Tampa. I've got Johnny all the way from Brooklyn down the line, but I again want you to participate and ask your medical questions or concerns by calling 813-239-9663. Again, that number is 813-239-9663. Let's go to Johnny. Good morning, Johnny.
Hi, from Brooklyn, where it's a beautiful day and start of June. I enjoy the program. I'm a listener for a little over a year now. I wanted to thank you for turning me on to allulose and getting me off blank etol kind of sweeteners.
Yeah, exactly. You're welcome.
I don't use that much, but I do enjoy a cup of coffee with a little allulose in it. I actually travel with it.
Good.
Because it's hard to find, so I stock up and keep a supply.
That's the way to do it, because it is difficult unless you're ordering online. Because most of the allulose I've found is that and the monk fruit get polluted with other things.
I noticed the thing I was using before Swerve was erythritol and allulose. Tasted
yes,
good, but that got me started, so that's good. We don't even stock it at our Park Slope Food Co-op, unfortunately, but we can put it on the suggestion list. I'm celebrated my 1 year. I'm in a clinical trial for sleep apnea treatments from Mount Sinai, and I have a CPAP, and I get good scores most of the time. It's helped me in a number of ways. I called before and told you that I don't get drowsy in the afternoon, and there's just been a little bit of weight loss. I do notice that my irregular heartbeat is better. And my question is about CPAP because it's time for me, my period is up. It's time to give blood again. Last time I gave a double red cell donation, and I was reading, doom scrolling on the internet that if you have, what do you call it, low blood oxygen, that giving red cells is not a good idea. So that's a question about the blood oxygen.
Let me address that one. Generally, people with sleep apnea don't have low blood oxygen except for those periods at night when they aren't breathing. And so people with COPD, emphysema, other lung problems, pulmonary fibrosis, they have constant low oxygen. My dad suffered from that. He ran around 90%, and we're supposed to run around 98%. That was at rest, and I know it dropped down into the low 80s when he moved around. However, sleep apnea, when it's severe and you have a lot of hypoxia at night, you do get too much blood on board. That's one of the clinical signs of it. So you I think would be probably fine donating a regular amount, and it depends on what your hematocrit, hemoglobin actually are. That when they do that test to make sure you have enough blood to be able to donate, if you're in the 15 to 17 range, you can probably give 2 units.
Well, okay. I'll be heading over there this week. So that's good.
Yeah, they'll advise you of what you're allowed to do based on your actual hemoglobin level, I think.
Oh, well, that's good to know. The other thing is because my doctor gave me a good physical, I actually asked for some of the extra, Cleveland Heart Labs and what do you call it, omega-3 test, and I have a good amount of data to go through, and I can improve. My A1C actually dropped, so he's not keeping me as pre-diabetic anymore. I think part of that sleep apnea treatment, but also the allulose and less alcohol. So I'm guessing that had something to do with it. So I have less arrhythmias with less alcohol. When I do have some, I actually keep track now every day because I track my CPAP performance. I also track did I have wine or beer. And I guess my last. Oh well, he had me get a home blood pressure meter, but it's from Omron, and it says that the blood pressures are unreliable because it detects AFib. So.
Oh yeah, it can misread if you're having arrhythmia, but if you're actually in a normal rhythm, it'll be better. So you always in atrial fibrillation?
Well, often when I go to take my blood pressure at home, it gives a report like AFib detected.
Oh, so I wonder, is your sleep apnea fully treated? Like, do you have oxygen data from nighttime that shows you do not desaturate?
Well, I just took mine using a smartwatch, and I'm at 95% now.
But during the night, does it ever tell you that you have low oxygen at night?
No, I don't have any kind of monitor.
Oh, okay, yeah. And that's what I was talking about with the other woman. It's like nobody seems to check to see if your oxygen goes low after they give you a bit of a treatment. The CPAP machine, when it does its electronic reading, it just looks for events, which means that you needed assistance. And that doesn't tell you in between whether or not your oxygen level dropped, because the CPAP machine doesn't have any oxygen in it. It just has air. And so if you're not using it, you still have low oxygen. So it's really a challenge, I think, sometimes because nobody's following up on the oxygenation, and that's the deadly part of this issue.
I see.
So I'd request an overnight oximetry from one of your doctors and see if you can figure out, because your A1C should be like really going down if you're treating it fully.
You know what? I'm in touch with the clinical trial people. I'll ask that. It might be good. They had a special watch I would wear and then mail it back, or and I think it maybe connects on the internet or something to give them the data. Yeah. So that was good. And then my last question is about functional medicine. Is it possible to have a successful relationship with a functional medical doctor that's all remote or telehealth, or is being in person really necessary all the time?
Well, functional medicine deals a lot with metabolic coaching and lifestyle coaching and deep dives into understanding about what's going on. And so personally, I'm finding that my practice being completely remote telemedicine is working well. And it took a little while for some people to get used to the idea, but my exam is in words and labs and understandings of what other people have done. I rely on the primary care doctor diagnosis and the specialist diagnosis and the studies they've done to flesh out what I do on the metabolic side.
Oh, I see. Well, good. I think that's on my New Year's resolutions list, and it's almost halfway through the year. So,
yes,
for the guidance there. And thanks.
Glad to be of help. And honestly, I think that
I'll find the tip jar again.
Beautiful. Thank you so much. And have a good luck searching for your local functional medicine doctor if you want, because it's sometimes really good to see somebody in person. But I believe that Zoom works really well over the pandemic. I got used to it. A lot of people got used to it. And we do some great work together that way.
That's good to know. Thank you.
You're very welcome.
Thank you there, Johnny. And anybody hitting that tip jar and making it ring is a good friend of mine and a good friend of WMNF. And a good friend, I'm sure, of Dr. Fred Harvey and the Healthy Steps Radio Show. We're down to about 20 minutes left in the show, so if you want to participate, give us a call at 813-239-9663 to address your medical questions or concerns. I do have Norm and Patrick in the queue, but first, repeat that number for you one more time. It is 813-239-9663. Let's go to Norm. Good morning to you, Norm.
Right. How are you doing this morning? So my question,
I'm doing well. How are you?
I'm doing fine. My question then comes down to when you talk about, when you mentioned functional medicine. I mean, what if there's functional medicine? First of all, is that a separate degree now program? I see some people listed, and I'm on your website as ND. Is that natural? And I see some people listed as MD. Then I said this again. I see ND. So what difference? What is the, when you talk about the metabolic function of that you look at one's well-being? What's so different from that and what we have in terms of understanding the metabolic function? Let's say that a specialist would deal with, an MD specialist would deal with, let's say somebody who's a urologist or a person who, let's say, is a nephrologist and stuff. When we talk about metabolic and
there's a big difference, actually.
Go help me.
So I'm an MD, and there are NDs, and there are ARNPs, and there are ODs and DOs and all kinds of people that can actually get certified in functional medicine. Functional medicine is a new paradigm in which we look at human health rather than naming, blaming, and treating illnesses. We look at human health and function, because it is when dysfunction occurs that we end up developing disease. So if we can fix the dysfunction, then the disease is not relevant.
Okay, but your diagnosis still relies upon radiographs. Your diagnosis still relies on modern day testing, and you were talking to one gentleman about his oxygen level. I mean, 30, 40 years ago, we didn't have these tests that actually went down. I mean, and that looked at the saturation of oxygen in by the tissue. But
now we do have the possibility of looking very deeply at all kinds of things like this. And because we have that ability, we also have interpretive ability. So rather than simply looking at an abnormal laboratory value and saying, oh, your sugar's high, you have diabetes, here's a pill, we actually look at much more than that. And we look behind the scenes at what's called the metabolome. It's the chemicals in your body that are associated with the function of your metabolism. And we can find abnormalities in the metabolome that aren't disease, but are dysfunction. And when we fix those dysfunctions, then people function better and they don't have disease. It's not treating disease, it's lifting up humans.
So how would you treat a condition? You bring out another point there, but
I don't treat a condition. I don't treat a condition. That's your question. I don't treat a condition. I treat a human.
Okay, but let me ask, how do you, is there a condition called functional, let's say, medicine and functional medicine dentistry? And another thing too, how do you identify
there is
genetic disorders such as
I don't treat genetic disorders.
a genetic disorder such as a sickle cell anemia or such as Ehlers-Danlos syndrome.
I don't treat genetic disorders. Functional medicine doctors don't treat disorders.
Okay. So then, how would how would you distinguish between, let's say, you have if you're getting down at the interstitial level at someone's looking for someone's metabolism, okay, and we know that each individual is a dynamic entity. I mean, how do you Again, I mean, it seems like you're practicing medicine, but you're calling it by a different name, and you're saying, okay.
Well, yeah, my basis is in training in allopathic medicine, but I've gone beyond that, and we understand systems-based biology and the interconnection of all of the functional parts of the human being. And so when I work with someone, I take care of the whole being, and then the illness is less relevant to that being.
One more question, and I know you're busy here. You talked about, you do things telepath, and there is a stuff called a functional dentistry.
There is.
Then how then do you do a physical examination? If I'm a dentist and I look in someone's if I would look in someone's oral cavity and stuff, and I'm looking for checking, I see that a person has a loss of bone mass or surrounding their teeth. I mean, I can't. I would have to do a physical examination on that patient. Probe the patient.
If you're interested in diagnosing that condition. If you're interested in diagnosing a condition, you need to actually have an exam and a study. But what's that?
Right.
But so I'm not diagnosing conditions. I'm not doing that. That's not what functional medicine is about.
Okay, all right. Then it seems to me you're leaving out an essential component of
that component's already been taken care of by other doctors. The standard doctor's already done the diagnostics. I'm helping the person understand what the diagnostics mean.
All right. Okay, yeah. Okay, I got you. Okay. All right, I just wanted to challenge you a couple of questions here. That seemed very interesting, understanding how this process takes place and those sort of things. But, okay. All right, thank you so much. You answered. Thank you very much.
You're very welcome. And if you want to know more, you could always book a discovery visit with me, and we can talk about what I would be doing individually for you with your issues, because that's what the discovery visit's about. Are we going to work together? I want to explain to you how we're going to go about working with what you've brought to me.
Okay.
Before we ever get into deep work.
Let me ask you a question then. You bring out something else. How then do you build these procedures are they under, let's say, the CPT codes? I mean, how do you make that? How do you make
for me,
that evaluation? And
for me, they're not under codes. I don't use codes. I'm not in that system.
You don't use. Okay. All right. Good. So you don't take any insurances then.
Correct.
So if I want. Okay. Good. Now me, I like that one.
So do I, because they're painful corporations to deal with.
Right, and these third-party people who come in, we could talk days for that. Yes, okay. All right.
So, Norm, thank you. Great input, good questions. Love to speak with you again. Have a great day.
Absolutely. Okay, bye-bye.
Okie dokie there. We do have a few folks that have been patiently waiting. I've got Patrick and Linda. Let's go to Patrick. Good morning to you, Patrick.
Good morning, Dr. Harvey. How are you doing?
Excellent. How are you today?
Pretty good. So just a question regarding existing conditions, Parkinson's, and was thinking more and more about how the lymphatic system, that's with a G, not with the L, lymphatic system.
Yes, the glymphatics, yes.
Right.
This call will be recorded.
Operates in regards to sensing the brain. So that's activated, as you're aware, by deep sleep or slow wave sleep. So I bought myself a wearable called Athena S headband that has like EEG type sensors on the brain, so it gives a pretty
Yes.
accurate representation of what's going on. And Discover has no deep sleep at all, and very little REM sleep. So,
Oh.
so schedule a sleep test, and meantime, start doing doctor AI and use the Claude AI. It came up right away into your medication you're taking, which consists of for Parkinson's, which consists of methadone and trifluorohexafenadril, if I said that correctly. And those together were known sleep disruptors. So they go, wow, I wish my neurologist had told me this 4 years ago when I started taking these other drugs. So on the way off, I'm off of trifluorohexafenadril and in the process of getting off of managing too. So I have results from my sleep studies to review tomorrow with my sleep study doctor. Basically, it's showing essentially some sleep apnea, maybe about 6-7 episodes. And it shows essentially restless leg syndrome, which I was surprised at that. Didn't see any symptoms in the past. So thinking perhaps my night tremors might be causing false reading on restless.
Well, restless legs, you might have some adverse consequences from the medication you were taking that might do that, but you do have a sleep doctor, is that right?
Correct.
Yeah, well, if you're not getting to deep sleep and REM, I think it's worth having a chat with your sleep doctor about maybe some other interventions there. But yeah, you're right. The Parkinson's disease really needs the central nervous system, drainage system, the lymphatic system to help clean it up and help it be better. And so, yeah, you may want to look into some different kinds of interventions. And you also might want to look at a metabolomic test. And the neurologists do not do metabolomic tests. You might have deficiencies of some of your amino acids that would support better sleep. You might be low in glycine. You might be low in tryptophan. You might be low in even you can get a neurotransmitter test that neurologists don't do and see if you have enough GABA on board to calm you down so you don't get the restless legs.
So could the restless leg be a false reading from my night tremors?
Well, it could be, but it could also be that you do have some metabolic abnormalities that could be addressed outside of doing medication.
Okay. What's that test again you called? What's the name of that test?
Well, the metabolomic test that I use is called the NutraEval, NUTREVAL. It's from Genova Diagnostic Laboratories, and it is a very good test for looking at what's going on behind the scenes.
Okay. Interesting. I have to check that with my functional medicine doctor. So, okay.
Yes, you can go to ifm.org and search locally. You can even look up Genova Diagnostics NutraEval and see what that test is all about. I've been using it for years, and it's really effective at helping people turn around.
Okay, you have an excellent functional medicine doctor. She's not discussed that with me in the past, so.
Oh, good.
Do that with her. Okay. Any other suggestions on what might help with achieving more deep sleep?
Well, I know that glycine is a very calming amino acid, and I take it fairly often in the evening because it's soothing.
Okay. Any history with CBN? Is it an effective sleep aid for deep sleep?
CBN is also an effective sleep aid, but it's going to be working on, and who knows, it may actually even help with restless legs. I haven't seen enough clinical studies. Fortunately, they've dropped the controlled level from 5 to, or from 1 to 3 for cannabis, so it can be studied now.
Excellent. Yeah, you heard that recently. Good news.
Yes.
Okay.
Well, thanks for your input. Great questions, and good luck with that.
Thank you. Thanks for your advice. Have a good day.
You too.
Thank you very much there, Patrick. And we're down to about the last 4 or 5 minutes, but we'll squeeze Linda on in. Good morning to you, Linda.
Hi. Thank you very much for squeezing me in. I just have a general question about air conditioning.
Yes.
Last year when I moved into the place I'm in now, I felt fine till I turned on my AC. When I turned on my AC and shut everything up, I got a lot of congestion, but I also got a lot of stomach pain and all types of digestive issues. And I worked with my doctor a lot, didn't find anything. And then, I'm here in Florida, of course, so I open everything up when it's like October, November, and we can stand to have doors and windows open. And I was fine, and I didn't even notice why. Just over the months, I got better and better. Well, I turned the AC on again, and here a month later, I'm having all these digestive and stomach issues.
Well, have you opened up the air handler and looked inside?
Yep. Yeah.
What's in there?
The AC guy come out and look at the AC, but not in the ducts. I wanted the ducts cleaned, maybe, or something like that, because it has to.
Do you notice any black? Do you notice any black dusty stuff around the air conditioning vents?
No, I was looking around for mold. No, I cleared. I got up there and took the vents down, and I looked. All I see is a lot of fiberglass, and somebody told me that could be it if it's old or crumbling. But I mean, I thought it was crazy that it's affecting, it's my nose, but mostly my digestive tract. But somebody was saying, well, you're breathing things in and you're swallowing things down. So it has to be something with that. And I wondered, had you ever heard of such a thing? Because most medical doctors are going to say that's crazy to me.
No, when I was living in my moldy house, I would get up every morning and puke.
Really?
Took about 3 years to come to full effect, and then it just continued to get worse after that, and I couldn't figure out what it was. Everything was normal. And a doctor would have said, yeah, you're crazy. But the bottom line is mold causes these symptoms. So you may want to actually look up the laboratory Real-Time Lab. Real-Time does mycotoxin testing. You can urinate in a cup, send it to them, and see if you have mycotoxins on board. If you do, then it's probably worth it getting a house test.
Real-Time Lab?
Real-Time Labs, yep.
Okay. All right. Yeah, I'll do that. And also, I'm very sensitive to a lot of medicines, and I wondered, somebody was telling me there's some kind of swab, maybe mouth swab test or some kind of blood test to see why I have such bad reactions to so many things. Have you ever heard of anything like that?
There are genetic tests that can show you how you react to certain medicines, but mold causes medication sensitivity. Mold toxins make you sensitive.
Oh, they do? Okay. All right. Well, this was before I moved, but I mean, they had told me something about, even before I moved into this place where I'm having this problem, that there was some kind of, I guess maybe, like you said, genetic testing for any kind of pharmacological.
And the people that actually dive deep with this kind of work are functional medicine doctors. It's going to be tough to find a primary care doctor to even have an idea of what test to order for you.
Okay, all right. And I already got, you said ISM.org, because that's where I'm going now. I'm heading towards functional medicine.
That's where to go. Go there and go to the doctor search and find somebody to talk to, because we're the specialty that talks about this stuff. We look deep because we know, and many of us have dealt with it. You know, being vertically ill is an uncomfortable place to be.
Well, and I like that you're treating what's causing things, not the after effects of whatever happened. You know what I mean? Like taking drugs on top of something that you could treat and find out what's going on, instead of just throwing drugs on top of something else that's happening that you.
That's exactly it. So go find one of my colleagues, and best wishes. Keep us posted as to what happens.
Okay. Thank you so much. Thank you. I really appreciate it.
You're so welcome. So I'm going to actually obviously not take any more phone calls. I don't even really think I have much time for any emails today. Sorry, folks. But in the meantime, I just wanted to mention that, next Monday is the fund drive. So get prepared. And remember, we're not going to be taking calls, but let's talk about money.
And thank you, Dr. Harvey, for another informative and rewarding Healthy Steps radio show. And thanks to all of our participants, listeners, and supporters. You make this show exemplary. And Sage, thank you for answering the phones today and all that entails. This show would not be possible without your assistance. You have been listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR headline news, and then get ready for the Sustainable Living Show, hosted today by Annie Ellis. So until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful.